Time now for the Business Spotlight on the WMAY newsfeed. It's sponsored today by the SIU Center for Family Medicine. Dr. Curtis Johnston is a family medicine practitioner with an important discussion because we're in the time of year right now when people are coming down with a lot of afflictions, a number of which could mimic symptoms of COVID. We have allergies, colds, the flu, all potentially going on at the same time. How do you tell the difference? Dr. Johnston, thanks for being here with us. We appreciate it.
Well, thank you for having me. Very good questions.
Let me start with allergies, if you don't mind, because I think that's the one that's probably hitting people the hardest right now. We're going to get into a lot of these other things as the year moves on. But I know a lot of people are really feeling those allergy symptoms, all the pollen and other things in the air with the change of season. And so how do you really tell the difference if that's what you're dealing with, something non-contagious like an allergy versus something very contagious like COVID?
Yeah. So the allergy season is definitely in full force right now. And so it's extremely important to understand allergies versus other things. When you're looking at COVID versus allergies, there are going to be a few key differences. Okay. So the common things you're going to find with these things are cough. You can have headaches. And some people might even experience some loss of taste or smell sensation. Now, the reason for that is very different. Usually the loss of taste or smell is because of all the congestion that's going on in the sinuses and running down into the throat and, causing basically your tongue to be covered and things like that with drainage, with allergies. Now, as with COVID, the virus causes that. Okay. The key differences, though, is with COVID, you're going to be experiencing fevers, okay? With allergies, you're not going to be getting fevers or chills. You're going to be experiencing things mostly up in the sinus region, in the ears and the nose and in the throat. You can have itchy, dry, watery eyes. You can have a stuffy or a runny nose. You can have ear fullness. You can have that sensation that your ears are just plugged and popping. And then with the cough, you're going to be experiencing more of I have to clear my throat type of cough with allergies, whereas with COVID, you're going to be looking at more of that dry, hacking type cough. And you shouldn't be experiencing shortness of breath with allergies. So with allergies, you're going to be looking more at these congestion-related things and the sinuses and the eyes and things like that. Whereas COVID you're going to be looking more into the systemic things with the fevers and the shortness of breath.
Some of those same symptoms may also surface with the common cold. We're also into that time of year now where that's going to become more prevalent. Walk us through again some of the key differences between standard cold symptoms and what you might experience if you had in fact contracted COVID-19.
Sure. So these two are much more difficult to differentiate because they're very similar. There are key differences though. So first, let's start with the common things that they have in common. Fevers, chills, muscle pains, fatigue, headache, cough. Differences is you typically don't get too short of breath with flu, but you can. It's much more common in COVID-19. With the flu, you can have a runny or stuffy nose. You can maybe get that with COVID, but with COVID, it's usually dealing with the lungs and the fevers and things like that. And with the flu, you're typically not going to experience loss of taste or smell. So really the key differences are the shortness of breath, the loss of taste or smell. But the common things are what makes it difficult. So my recommendation would be if you feel like you might have the flu or you might have COVID, then I would recommend you getting checked out. Call your doctor, go to an urgent care, get tested so you can figure out what's going on.
I think it's a really important point that, again, if you have any doubt at all, tests are readily available. They're easy to get. They're no cost. And so you really should get that test just to make sure that you are not dealing with something that's potentially a good deal more serious than some of these more common seasonal ailments that we're talking about here. We're talking with Dr. Curtis Johnston of the SIU Center for Family Medicine about some of these more common seasonal problems that people encounter and how to tell the difference between that and COVID. And Dr., of course, another big component to this is the fact that we have vaccines available for COVID-19. We also have the flu shot readily available. If you haven't gotten them yet, it's a good time to get both. But can people do both simultaneously?
Absolutely, they can. So the CDC has made a recommendation that it has been found to be safe to have both vaccines administered at the same time. So our clinic is administering both of these vaccines at the same time. Most clinics are, and I would recommend getting both vaccines to protect yourself and others throughout the flu season, especially.
Again, these are not things you want to leave up to guesswork. If you have any questions, any doubts at all, you should contact your medical practitioner. If you don't have a medical home, you can reach out to the SIU Center for Family Medicine to make an appointment. And Dr. Curtis Johnston with the SIU Center for Family Medicine, how do people reach you and SIU?
Yeah, so you can go to our website at siumed.org for more information. To reach our clinic, SIU Family Medicine, you can call our phone number at 217-545-8000 and ask for family medicine. They'll get you set up with us.
Again, 217-545-8000 or siumed.org. And of course, here each week in the Business Spotlight on the newsfeed, WMAY on 92.7, 94.7, and 970 AM.